So without further ado, I'm going to facilitate the morning session, and I'm absolutely delighted to invite to the podium Miss Mary Wynne, the Director of the Office of Nursing and Midwifery Services, and Mary's going to present to you on this work and on QI today. Thank you.
Thanks, Anne. Good morning, colleagues, and can I say thanks for not going to the beach. I know it was a close run thing, and I'm very familiar with Cork and its environs and how beautiful it is, and I'm sure you're all itching to be out paddling in the water. But thank you for your commitment to be here today. So, ladies and gentlemen, colleagues, friends, and distinguished guests, particularly Professor Mary Ellen Glasgow, all the way from the USA, Dr. Amy Ryan from the department, and Professor Drennan from the local spot, shall we say, and UCC nursing faculty members and yourselves. I'm really delighted to be here today. As a Cork from these environs said, have a nice time in the real capital, so I am. So today is a celebration, and I'm just thrilled to be here today. I think it's a real landmark day, and it's a day we will remember, I think, in years to come. And certainly, our office and my staff are really committed to making this a success, as I know you are too. On reflecting on the title of my address, Nurses and Midwives Leading Safety and Care, I began to ask the question that has been posed in many reference books, journals, publications and hefty tomes, and you will always find an opinion as to what nursing and midwifery is. The English Oxford Dictionary simply refers to nursing as the practice of providing care for the sick, and a midwife as a person, typically a woman, who is trained to assist women in childbirth. Now, we all know that the sum of our parts is much greater than that. Florence Nightingale, in her pioneering work during the Crimean War, changed the face of nursing, leading it to grow our own profession with our very important responsibilities and commitments to our communities. On the 4th of November 1884, Florence and her team arrived in Scutari in Constantinople. And I believe that she had about 20 nurses, some of them from the Mercy, with her. So we have a proud tradition. They were not impressed with what they found there. The hospital was filthy, the drains were blocked, and there were rats and fleas everywhere. Florence and her team made lots of improvements. They had the drains cleaned, sorted out a safe supply of drinking water, filled the hospital stores with clean sheets and bandages, made sure the soldiers were well fed and cared for, and even started rostering. Florence, of course, was much underestimated by history in some ways. She was, in fact, the first epidemiologist. And she showed on her Rose graphs how it proved that the hospitals were actually killing more soldiers than the battlefield. She presented this evidence to the War Office, who you can imagine were not delighted with what they were telling her. So she was a brave and courageous woman, and she used evidence to make her point and to make improvements. So what does the 21st century nursing midwifery look like? We have achieved many developments to progress our professions since the era of Florence and her team, to include developing our knowledge, skills and competence. We have come a long way. We have introduced career pathways, specialist and advanced practice roles, academic scholarship, and we have embraced and embedded technology where it's been available. We shape policy and reform of the health service. We can now influence and provide strategic and operational leadership at all levels in the healthcare system. What a long way we've come. And in 2017, a Gallup poll to establish the most trusted and ethical professionals, society ranked nurses and midwives as the top professions. So no pressure then. Despite all of the challenges and the change, we have progressed our professions in a very real way. Nurses and midwives, I would suggest, continue to be the glue, or as another colleague says, the connective tissue, that holds the patient's healthcare journey together. We are the common factor across the entire patient experience. Whether there is someone in need of care, nurses and midwives work tirelessly to identify and protect the needs of their patients, their families, and their carers. In recent times, there has been a debate about the crisis of caring in healthcare. Nurses and midwives in Ireland have responded to this assertion by reaffirming our values. Through an initiative undertaken in 2016, my office, in partnership with the Chief Nursing Office in the Department of Health and the President of the Nursing and Midwifery Board of Ireland, secured your consensus of the core values that underpin our practice: care, compassion and commitment. This is what we know to be important. The public expect to receive nursing and midwifery care from compassionate, caring and committed professionals. And this we can affirm as our unique quality and our contribution to safe, quality care. Patient safety is an essential component of quality of nursing and midwifery care, and we are often referred to as the gatekeepers of patient safety and quality. But we are more than this. We are the thin white line between patient safety, the patient experience, and suboptimal care outcomes. The impact and importance of what we do every day to keep patients safe and to deliver quality nursing and midwifery care is what our patients and their families remember in relation to how we cared for them. Patients and their families know quality care when they experience it, and so do we, as many of us have also used our services. We notice how quickly the call bell was answered, the bedside manner and caring attitude of the nurse and midwife, the time spent with the patient. All of these things affect how people feel about the quality of their healthcare experience. The quality of nursing and midwifery care is a multidimensional concept that is difficult to define and measure. And as professions, I think our difficulty to articulate what it is we do, the depth and the breadth of it, has in some ways been a challenge for us. Every person in society has a view as to what it is. And I suppose if we put them all together, that probably would be the sum of it. But to articulate it is really a challenge. There are many different understandings of quality, and many of you will be familiar with the Institute of Medicine's dimensions of quality: safe, effective, patient-centred, timely, efficient and equitable. And I would suggest as a nation we have some way to go along all of those dimensions. Despite the different understandings of how to conceptualise nursing and midwifery care quality, common themes that transcend the care continuum are the requirement for competent nurses and midwives delivering consistent evidence-based care to address the needs of their patients. 2 years ago, my office set about to establish what are the important things that nurses and midwives do in their day-to-day caring for patients. That's what we set out to do. Often called nursing and midwifery interventions or the fundamentals of caring. These important aspects, according to Donna Bedian, are referred to as care processes. We know from research that context influence patient outcomes, and many of you will be familiar with the Task Force on Safe Staffing research currently going on, actually with Professor Jonathan Drennan here. And this has provided concrete evidence of the influence of variation in staffing levels to patient care outcomes. Now, we all knew this, but we couldn't actually prove it until now. So having the evidence is key, as it is with quality care metrics. The quality care metrics research, commissioned by my office and undertaken by University College Dublin, University College Limerick and the National University of Ireland Galway, has for the first time in Ireland, and to the envy of many countries internationally, determined the important nursing and midwifery care processes that should be measured in order to provide consistent evidence-based care across the nation. So this is really a landmark study, or perhaps we should call it 7 studies, because that's what it was. It's a huge amount of work. What makes this research unique is that the evidence has not just come from the literature. The methodology employed has ensured that the voices of patients and service users, nurses and midwives have communicated and co-designed the professional standards of nursing midwifery care quality. And that is a key, I suppose, it's so key that it is co-designed, because we're not just talking to ourselves, we're asking our patients, what's important to you? What matters to you? The culmination of this research has resulted in a suite of 7 care metrics reports. Normally I get to launch one book at a time, but today is a bonanza, and they're all on the website, so please, for your area of practice, access them. I'm sorry we don't have hard copies for everybody, but it is accessible and it is there, so please go online. I'm very proud today to formally launch the quality care metrics for acute care, midwifery, children's nursing, public health nursing, older persons care, intellectual disability and mental health nursing. We're all here in this room and we're all in it together. I'd like to take this opportunity to thank all of the patients and service users who contributed to this work. I would also like to thank the academic team from UCD, led by Professor Lazarina O'Connor, who unfortunately couldn't be with us today, Professor Ailish McAuliffe and Dr. Maria Brenner. The research teams of the University of Limerick are led by Professor Fiona Murphy, Dr. Owen Doody and Rosemary Lyons, and the research team from NUIG, led by Professor Declan Devan, Dr. Andrew Hunter and Professor Valerie Smith. In addition, I would also like to convey my thanks to Professor Mary Ellen Glasgow from Duquesne University, Pittsburgh, USA, who is with us today, and we're delighted that you're here, Mary Ellen, and who contributed as the international expert reviewer to the research study. I would like to thank the group directors, the Directors of Public Health Nursing and all the senior leadership across the country who have encouraged their staff to participate in the metrics and who are eager to adopt them. I would like to thank my area directors and the 8 nursing, midwifery and planning and development units around the country, and in particular their project officers, some of whom are here today, I don't think they're all here, Anne, who so diligently worked and just worked really hard to make this happen and pull it together with the academic teams to ensure that the research goals were met. So thanks to one and all. Finally, I wish to offer my sincere thanks to Dr. Anne Gallen, who has led this work on behalf of the office and our professions. Nurses and midwives are central to the delivery of safe care. We are now equipped with the evidence-based metrics to showcase our contribution to patient safety and to enable a sustainable culture for continuous quality improvement. The truth is we'll never be there because every time we improve, the goalposts move. So it's a constant re-energising and a recommitment to do better, to do things differently. I think it's really important, and I think QCM is really an example of this, that we value both the intellectual nature of our work. Sometimes we don't speak about that. And as somebody said, I can't remember who it was, said, quality doesn't happen by accident. It happens by the application of intelligence. So, this is a huge example of that. And it's the intellectual endeavour coupled with the interpersonal work that we do that makes our work excellent. And I think QCM puts nurses and midwives in the driving seat to say what is good about their work, what they need to improve, and how they will improve it. And as we're moving forward, we are very busily planning as to how this will be further implemented and scaled up. We will need you as champions in this system. We have a lot of people there already who have championed it. So our work will never really be done, but it's exciting. I look forward to working with you all to further establish quality care metrics across our healthcare system. I look forward to what we're going to learn from them, and I look forward to how they're going to change in the future. I know they've just landed, but I think we have to recognise that they will actually change. But we will be changing them with our patients. QCM has travelled the road of co-design and cooperation, intellectual effort and personal commitment. So it is a wonderful example to all who have been involved. So thank you for being here today, and I hope you get to the beach in the afternoon.